Thank you, Derek. We're both very honored to be part of this webinar, and I am Lori Walkner, and my pronouns are she, her, and hers. And I'm with the Midwestern Public Health Training Center, which Hannah will tell you a little bit more about our center in just a few minutes. I also serve as interim director for the Institute for Public Health Practice at the University of Iowa College of Public Health, where our center is housed. I've been in workforce development for more than 25 years, and every day is a great learning experience. And I just look forward to spending time with you all today and sharing our collaborative work and just hearing from the audience on what you have to say as well. So right now I'm going to turn it over to Hannah so she can introduce herself.
Thanks, Lori. My name is Hannah Schultz. My pronouns are she, her, and hers. And I work with Lori at the Institute for Public Health Practice and the Midwestern Public Health Training Center, which are both housed at the College of Public Health at the University of Iowa. And I always joke that we make our titles as long as possible. I promise it's not to eat up all of our presentation time. I help to do outreach at our center, so make connections with public health departments and others who are good partners of public health, as well as to coordinate the center with Lori. So I'm going to talk just a little bit about who's involved in this project before we get too far into the meat of the presentation today. So the Midwestern Public Health Training Center is one of 10 public health training centers, and we are funded by the Health Resources and Services Administration, which if you think back a couple of slides to Derek's graphic, we are also under the National Institutes of Health. I like Derek's graphic. Maybe we'll have to do one of those to put on this slide for next time. We are one of 10. Each of them is housed at an academic institution. And while Derek has Midwest in the name of their center, we have Midwest in ours. The only state that overlaps between them is Iowa. So different definitions of Midwest. Each center works on workforce development for the public health workforce, but as we will talk throughout today's presentation, that can look really different depending on what the needs are. So we've been working on this project with the Network of the National Library of Medicine in partnership with Derek and Nora. We've also been working with the Public Library Association and the University of Iowa College of Public Health Prevention Research Center. So Lori, I'm going to turn it back over to you to get started on exactly what this project is that we're going to be talking about.
Okay, thanks, Hannah. So I just like to start off with the why, and we'll cover the how and the what in just a few minutes as well. So with the why, many of you are probably aware, but for those of you, I just like to kind of give an introduction about why these relationships and partnerships are so important and how we kind of started off why we looked at each system. I think all of us are hearing more in the news about how important it is to look at systems and partnerships and collaborations. And so this all started a few years ago through our partnerships with Derek and Nora, and looking back on some of the literature and things that were coming up, we saw that the American Library Association estimates that there are over 16,000 public library buildings that are spread out across the United States. And these libraries, as you know, reach urban, suburban, and rural populations. Public libraries see more visitors than physician offices in a given year. And research shows that many individuals utilize public libraries for health information access. In fact, a study from 2015 found that over 40% of computer-using patrons reported using libraries to search for health information, which I know you probably all know about. And the information including anything from the opioid crisis to telehealth, just to overhaul health literacy, showing that libraries are well positioned to cost effectively collaborate and support access to improve public health messaging, literature, and just to build healthier communities. And what about public health? Well, the United States is home to approximately 2,800 local health departments that serve their communities with important public health services. In Iowa, we have over 99 counties, and each county has their own public health department. Over the last decade, however, these departments have faced, just as well as the public libraries, have faced workforce challenges. 1/5 of the local public health departments noted decreases in their funding in 2017 budgets. Between 2008 and 2017, more than 55,000 jobs were lost as a result of continued funding cuts. Fewer workers and smaller budgets have really forced those health departments to sacrifice programs and those services known as the 10 essential services that they provide and become more creative and share services and outreach to their local communities. So to address these challenges, health departments can look to better partner with local public libraries. However, we know that libraries are also taxed. Librarians are really asked to provide help preparing taxes, to making appointments. They were part of support with the healthcare exchanges and have been instrumental in this year's census. They've been contact tracers throughout the pandemic. As such, we know librarians are versatile, they're flexible, they're very knowledgeable, they're able to respond to the needs within their communities because they know their communities so well. We also know that they are asked to take on responsibilities that are far beyond what they signed up for. Libraries and public health are almost perfect partners, or they are perfect partners. They are both well equipped to address community needs and in ideal circumstances are deeply embedded in their communities. They're also perpetually overworked and underfunded, making these partnerships even more critical to their success. Libraries provide direct services, are involved in addressing those upstream causes that affect downstream problems. While we use different vocabularies, social determinants are really woven into the fabric of all of our beings. Through this work, we've talked with librarians and public health practitioners from across the country. We really wanted to learn how they work together to identify themes, successes, and barriers that affect those partnerships out there. So that's the information that we'd like to present to you today, some of the work that's been done. And before we get more into that, I'm going to hand it over to Hannah to give you a little bit more background before we get going.
Thanks, Lori. I'm also going to ask Derek to open up a poll. So we'd like a bit of information about who is joining us today. Lori and I have talked about this work quite a bit over the last several months and are really excited about it. We've typically done it either to an audience of public librarians or to an audience of public health professionals. And we have a hunch that today there's a mix of those. So we're going to ask a few questions about where you are, what you do, and what kinds of communities you serve. We'll do a couple throughout the presentation today. So thanks for participating in those. Take your time. We'll close the poll in just a minute or two, but I'll keep talking a little bit more about this work. So as I mentioned, we often do these to one group or the other. So when we talk to public health practitioners, we share some of the great values and work that libraries do and vice versa. So just sort of randomly, I decided we're going to talk about libraries today. And I am sure many of you know a lot about libraries already, but I'm going to share a bit about the work that libraries do that make them such great partners for public health. Because we really think public health and public libraries are a natural fit for collaboration. Focusing on health aligns really well with the core values of librarianship, which include access, confidentiality, diversity, supporting the public good, and social responsibility. As Lori mentioned a moment ago, we tend to use different vocabularies in our fields, but a lot of the goals and values are very aligned. Public libraries are critically important to reaching lower income Americans and those who are members of communities of color who use public libraries at a higher rate compared to other community spaces. And the people in those groups also report significant help with learning new technologies, employment, and figuring out what information is trustworthy. Libraries connect people with authoritative information, access to technology, community-aware, community-focused guidance toward obtaining relevant services, and lifelong learning related to strengthening health and wellness. We know libraries are critical access points, providing access to good health and wellness information to all community members at no charge and with no consideration of health insurance status or income. We also heard through some focus groups that we're going to talk about in just a few minutes that one of the other really valuable parts of this access point is that there's also no consideration for immigration status or any other legal status. All people are welcome and served in libraries. Libraries provide specialized resources by building and maintaining carefully curated physical and digital collections. They offer materials related to specific medical conditions, but also support healthy lifestyles more generally. We heard from someone we talked to through this series about people using some of the digital resources that they could access at home, but they wanted the extra help from the librarians and navigating it more confidently. We also know libraries advance health literacy as well as other important literacies, teaching patrons how to critically assess health information, recommending the best health and wellness apps, and more. They also provide computer access and teach digital literacy skills, both of which are increasingly important to participating in today's healthcare environment. We've heard just in the last couple of months stories of libraries opening specifically for telehealth appointments for folks who need to speak with their physicians or other healthcare providers, but for those offices that aren't open as much as usual, libraries are helping meet that void for people who don't have strong enough internet or internet at all in their homes. Libraries help community members navigate government laws and programs, connecting them to social and public health services, health support groups, and other community-based resources. Libraries partner with healthcare providers through educational events, health fairs, pop-up clinics, co-located services, advocacy, and more programming. Libraries, this is particularly relevant right now. Libraries share critical information in times of crisis, including helping community members access emergency services, stay safe, and even get shelter sometimes. Public library programs and services beyond basic health reference and access to health-related materials are remarkably varied. Libraries are promoting enrollment in health insurance, training staff to deliver in naloxone, and many other important health and public health services. So we're going to share a few examples of some of the collaborations between public health and public libraries that we've heard about since doing this work in the last year or so. So in Perry, Iowa, library visitors can check out bikes, and the library partners with a local food rescue organization to make high quality food available for anyone who visits the library. They actually started this program, the food rescue program, in either February or March this year, just before closing the library due to COVID concerns. But in the few weeks that it was open, it went much better than they even dreamed it could. Staff from Perry will join us for a webinar in February that we are working on getting scheduled and will share information about soon. In Salt Lake, Utah, the library system has hired health navigators from the communities that they are seeking to serve. In San Francisco, where approximately 15% of library patrons are homeless, the Central Library maintains a full-time psychiatric social worker and a staff of formerly homeless health and safety advocates to provide homeless patrons with information about welfare services, such as meals, shelter, and legal aid. Baltimore's health department launched the Virtual Supermarket Project, where library patrons can order groceries online, which I'm guessing many of us are much more comfortable with now than we were a couple years ago or even a year ago. But in Baltimore, library patrons can order these groceries online and pay with SNAP benefits and then pick them up at their local library. In Humboldt County, California, library staff have been trained in administering naloxone, and public librarians and other urban centers are also being trained. We know this is happening across the country. And of course, right now, we know that librarians have been involved in contact tracing. So I'm going to turn it back to Lori to talk about the research that we've been doing for this project.
Thanks, Hannah. And I just want to point out too, if you guys aren't following the chat box, people are freely putting information in about what their libraries also provide around unmet public health needs, housing, hygiene, cooling, warming shelters, as Hannah started to talk about. Someone's in a nursing school and they're using the state library. Hope to gain better experiences and find nursing research. So also professionally, what that's doing. Also, college library may be able to help with finding professional journals for nurses. Just a lot of great things. So as we go on, please feel free to post what your library is bringing, if we're missing any of these, and we'll just keep sharing ideas, because this is how we all learn together, is to be able to share our experiences. And to get into experiences, I want to start talking about the focus groups that we conducted. I was lucky enough to be involved and to help facilitate some of those focus groups along with Hannah. As many of you know, focus groups are really great ways to collect qualitative information about lived experiences and to understand either subjects or problems or help with planning. You can use them for all kinds of things to collect that information, to get insights and thoughts and ideas. And that's what we did, is we reached out. We conducted 3 focus groups with public health practitioners and 3 focus groups with librarians in conjunction with the American Public Health Association annual meeting and the American Library Association midwinter meeting last year. Ironically, they were both held in Philadelphia. You know, it's really about trying to understand these relationships and use the information. We use the focus group information. And again, the reason we conducted 3 focus groups with each of these groups of practitioners is because you want to conduct enough focus groups where you're getting saturation and you can see themes that are reoccurring. So you know that you're on the right track when you start to hear some of the same things emerging from those focus groups. So that was really good. There were some uniquenesses that came out between the 2 groups, but also within the groups. And so that helped us formulate questions for an electronic survey that was distributed to public health practitioners and librarians. We were going to do it earlier in the summer, but had to delay sending it out until a little bit later in the summer. So we'll talk about that in a few minutes. So about the focus groups, we usually with the focus groups, and many of you have probably either held focus groups or been a part of the focus groups. But we really try to start out with general questions that kind of peak or take you back to the bigger picture and then get into a more focused discussion on what that ultimate question is about. So we asked librarians what they think when they hear the word public health. And again, this was pre-pandemic, so that might change now. And then we asked public health professionals what they thought when they heard the word public libraries. One of the interesting and unfortunately not surprising things is that we learned that public health people tend to have a good idea of what libraries do, maybe not the extent as we're seeing right now in the chat box of the libraries' involvements in their communities, but a pretty good idea of libraries, right? Because a lot of us use our libraries. Librarians, for the most part, didn't have as much of an in-depth understanding of what public health is. And again, the sampling was very small, so I'm not saying that we can generalize that at all. But there were a few notable exceptions, but for the most part, we heard things like chronic disease, infectious disease, visiting nurses, epidemics. We had a few people who commented on awareness and prevention, education, which are part of the 10 essential services of public health. Community structures, showing a deeper understanding of public health. A few librarians said that public health departments or professionals are experts sharing information and will say things like, we're the diabetes educator, here's what you need to know, which is contrast to librarians who take a client-centered approach by asking what they like to know about diabetes and helping them find information. And again, this is coming from the participants. On the other hand, public health practitioners had a good understanding of libraries, and those we talked with had very positive feelings towards libraries, which was incredible to hear that strong of their thoughts. We heard people say libraries are a safe place, and we heard this just repeatedly, which was an incredible theme that was coming through several times in each group. People at times were nostalgic for the time they had spent in libraries, reminiscing about family and friends. We also heard several times that one of the big strengths, and you know there are many, but one of the big strengths of libraries is they are seen as a neutral place to go. They're not judgmental. When you walk into the library, people may be hesitant to go into governmental buildings like public health, or they may be more comfortable going where they're maybe more comfortable going into a library setting. We asked our groups about partnerships between public health and public libraries. Did they know or had they participated in partnerships? We were happy to hear that most people could name some partnerships, but it was also kind of disappointing to hear that there were challenges and barriers that they faced having long-term sustainable partnerships, which was really important to building these collaboratives. One of our participants lived in Philadelphia, which has a public health nurse employed by the library. Others knew of food pantries that would partner with libraries. Libraries would host health fairs or types of biometric screenings or other screenings. Many of these were examples people knew of as librarians or library users, but not as an example of a partnership their public health organization or agency had forged with their library. One of the inspiring stories, though, came from two women that were from New Orleans, and libraries were a vital part in the response and recovery following Hurricane Katrina, excuse me, and that has enabled continued partnership and also funding for the libraries in the city of New Orleans. One of those were directly involved in partnership between libraries and public health organizations. A few themes emerged among those were successful, such as formalized partnerships, either through memorandums of understanding or other mechanisms. Were really important indicators of organizational commitments. Institutional relationships rather than one-on-one partnerships seem to really be the key to sustainability, especially support from leadership, administrators and directors, and others in leadership positions. Trust and commitment that was built over time and community validation were all very important to the success of these partnerships. And I think you probably all can, or some of you can identify with some of those same concepts around collaborative partnerships. After learning about the successes of partnerships, we asked what prevented the success of partnerships, or what barriers?
Lori, I'm going to jump in for a second here.
Oh, sure.
Sorry to interrupt you. The chat has such great examples in it right now. And before you start talking too much about barriers, I just wanted to point out that some of the barriers that we heard in our focus groups are coming through in the chat. So things like staff at libraries already having so much to do that taking on something else, they're just stretched too thin. We also have a couple of comments about staff turnover, that projects will last as long as the staff is there. So I think it's interesting that these are already coming up in the conversation in the chat before we've even started getting to that point in our conversation.
Thanks for pointing that out, Hannah. That's exactly where we are right now with those questions, and it does bring back memories of what we found with these focus groups. So some other barriers, and go along with ones that you guys have already posted. I haven't been watching them come up here, but many of the barriers we heard could be lumped into the category of management. We heard about great programs that they reached many people, but again, going back to that one-on-one partnership, if one person left, then the program really kind of started to fall apart. Or if it was funded and the funding went away, then sometimes that partnership would go away. So it just underscores a need for institutional relationships that are inclusive of leadership rather than relationships built by one or two staff members from each organization. And turnover and succession were some of the most frequently mentioned barriers as well. Also related, there were challenges related to continuity, primarily around making sure that relationships were fostered and sustained. And again, we know, as you've been posting in here too, that it takes time to develop these relationships, and it takes a lot of thought, and you've got to spend time in getting those relationships established and maintaining those and nurturing those relationships, rather than coming together infrequently when the need arises. And we know that even in times of crisis, you don't want to start exchanging your business cards. You already want to have that relationship established, because you know what those partners bring and what resources they have. And having regular check-ins or working together on long-term planning can also help. And looking at your values and those missions and getting back to the core of what we're all about, both entities totally about. Other challenges that were brought up is one that is frequent when working with people in other sectors or fields, a lack of standardization. This could be as simple as a lack of shared language, which is something our partnership with the Public Library Association and Public Health Researchers have worked hard through to begin our work, or having different processes or being on different strategic planning schedules, requirements for funding, and that came up repeatedly too, ever-present barrier of funding was brought up by the majority of the participants. Participants talked about which entity is responsible for different costs and the challenge of sustaining successful programs after funding runs out. And sometimes that's not in the forefront of our conversations when we first get funding and start these partnerships. Focus group participants also brought up some legal and logistical challenges. While these were not insurmountable, these did have the potential of hindering the progress or even stopping work. We heard challenges with space limitations and liability issues, allocating staffing. Some libraries even had banker hours. So that means that the library was even less accessible to certain segments of the population. During the focus group, I love doing focus groups because it seems like it's also kind of a peer support system. The focus groups helped discuss more about potential collaborations. For one of our focus groups, one of the public health practitioners that was there said, "Oh my gosh, I could use public libraries, or I can invite public libraries into future community health needs assessments and that work." And so it really did help facilitate more discussions and more thought about how these partnerships could evolve and what direction they could go in. So I'm going to go ahead and now turn it over. That's the focus group part of it, and I'm going to turn it over to Hannah to talk more about the surveys. Thank you.
Thanks, Lori. It took me a moment to find my unmute button. Sorry about that. So we used the information we gathered from the focus groups to create a survey. And the survey, as probably as the theme of 2020, did not go quite as planned. We were hoping to release it last April, and we wanted to send it to public health departments, public health professionals, and public libraries. And we know both were trying to figure out which way was up last April. So we did hold off and we sent it later in the summer, still with the understanding that libraries were still reacting to the ever-present challenge of COVID, and that most health departments are very, very, very focused, if not entirely focused, on COVID-19 right now. So we did an online survey. It went out to a national group of people. We had a bit over 100 responses, and about a third of them were from public health, and a bit over half were from public libraries. We had a pretty good distribution of sizes of communities. So we had some people from large urban areas, some from very, very tiny rural communities. So we were really pleased with that. Just as in the focus groups, as Lori just talked about, people have very, very positive feelings about libraries. So we did split up the survey, and the people who work in public health got more questions about libraries, and librarians got more questions about their perceptions of public health. So people had overwhelmingly positive feelings toward libraries. One theme that we have heard repeatedly in the focus groups, and Lori brought this up, was that libraries are safe spaces. And in the survey, almost 90% of respondents agreed or strongly agreed that public libraries are safe spaces. The other 10% were neutral. Nobody disagreed with that assessment. So, it's really important for us in the public health side to recognize that and recognize the value and trust that people have in libraries when we're thinking about partnerships. It also came through in the survey that libraries are considered credible and vital community resources. Also, just like in the focus groups, we found that people had less of an understanding of public health. For example, only about 28% of respondents disagreed or strongly disagreed that public health's main function is to control epidemics. It is important to recognize that this survey was conducted in the summer of 2020. So COVID-19 was heavily on everyone's mind, and it's absolutely true that right now a huge part of public health is pandemic response. But it is a little telling that a good portion of the people responding to this survey thought that was public health's only function or primary function. 94% of respondents say public health agencies support communities, so there is definitely a recognition of public health. However, the distribution of responses for many of the questions about public health was greater than that for libraries, so there was less consensus around the role of public health than there was for the role of libraries. Importantly for our work, fewer than 40% of the respondents knew of a public health, public library collaboration. So that tells us there's a whole lot of opportunity out there for encouraging and supporting these populations. And I hope in the last half hour or 40 minutes, however long we've been talking, that we've made the case that public libraries and public health agencies have similar and complementary roles in their communities and can be great partners. I did notice a question in the chat just before I started speaking about if we have published any of this research. The answer to that is not yet. We'll get to some of the work that we'll be doing as the result of this research in a moment. But speaking of publications, we're going to talk about a literature review that our group did. So Lori, I'll hand it back to you for that.
Okay, thanks, Hannah. I've just been enjoying reading all the chats. This is great. Excuse me. So as Hannah mentioned, one of the other activities that we did was a scoping review. Derek, Nora, and I were involved in this review to see what types of partnerships were present in the literature. And there were about 10,000 articles resulting from the review, just because it was such a broad review. But when we looked at those abstracts, we only found a handful that discussed partnerships between public health and public libraries. And the search went, I'll have to ask Derek, and Derek, you can chime in. I can't remember. It went back several years, I believe, to find out what these partnerships look like. So one of the articles that comes to mind in that handful of articles is an article entitled, which some of you are probably familiar with, South Philly's One-Stop Shop. And the South Philadelphia Community Health and Literacy Center was opened up, I believe, a few years ago, and it brought together a health clinic, a public library, public health, and a recreation center. They all coexisted in one location where there was healthcare, there was wellness, there was health literacy, all provided under one roof. And because it was all provided under one roof, it really helped facilitate these cross collaborations. They conducted monthly meetings to create community wellness initiatives. They were able to increase their number of clinic visits. There was funding used for adolescent health education awareness. So that was something that really stuck out, is when they coexist together. It seems to really help facilitate, which makes sense, helps facilitate those types of partnerships. So anyway, and if anybody else has any information, other information, wants to shout out about the South Philly's One-Stop Shop, feel free to put that in the chat as well. Anyway, so that was the scoping review that we did, just kind of a quick one. And I know Derek is going to be writing more information up about that to be shared out with everyone. And so I'm going to hand it over to Hannah, who's going to talk more about these collaborations.
So I love public libraries. I I try to really tone that down when I'm talking about this project so it doesn't overwhelm the information I'm trying to share. But this comment came from one of the public health people that we talked with in our focus groups. And I think about it a lot and I just really love it. So I wanted to put it up here. But, you know, I'm not the only person. This focus group participant isn't the only person who loved public libraries. One of the joys of doing these focus groups was the excitement of people wanting to talk about what libraries mean to their communities. Public health practitioners who weren't able to join the focus groups sent us emails and resources about what they'd seen and their thoughts. Those that were able to join could have talked all day. We literally got kicked out of the library. We were in one of Philadelphia's library branches, and the person kept saying, "You need to leave in a couple minutes. You need to leave. We're closing." And finally, she came and wagged her keys at us and said, "You have to get out now. I'm locking the door." And then people continued the conversation on the sidewalks. So it was really fun to hear everyone talking about how much they loved their libraries. Likewise, the librarians who joined the focus groups understood their place in their communities and talked about their value with humility, passion, and respect for their communities and their colleagues and their profession. People have super positive association with libraries, making them excellent partners for public health. Likewise, as librarianship changes and libraries become an even bigger part of the social network and social support of communities, having their expertise of public health available could ease their load and strengthen their work. And I want to point out, I did say as they become a bigger part of the social network, I know libraries have always been part of the social support network of communities. I think that's becoming more visible now for a lot of very obvious reasons. But there's a huge opportunity for mutually beneficial partnerships. Learning from the challenges and barriers discussed in the focus groups, as well as assumed outcomes of stronger partnerships, we've got some lessons learned and some recommendations for future collaborations. For the biggest benefit to both entities and to the community, goal setting should be done jointly. While this may seem pretty obvious, there are times when an organization is brought in after planning has begun for any number of reasons. So whenever possible, it's really important to bring partners together from the outset. Having ongoing relationships between libraries and health departments is a really good way to facilitate this. So both knows what the other is doing most of the time instead of just when specific projects come up. Libraries and public health departments have really strong networks in their communities. So bringing those groups together could have huge impact on their communities, from stronger network to heightened community trust. Breaking through these silos of project-based collaboration to long-term engagement has the potential to be transformational for public health, public libraries, and the communities that they serve. So I do want to point out, I know libraries and public health departments do a lot with partnerships already. So I think, you know, they are already some valuable partnerships to each other and to other community organizations. But they certainly aren't the only people that each of these entities should be engaging. So I want to just point out a couple of other really cool partnerships that we've been seeing. In Omaha, Nebraska, the health department has had a lot of luck working with the business community and other social services on affordable housing. In Black Hawk County, Iowa, the health department has engaged community leaders from across the spectrum, including elected officials, school superintendents, faith leaders, and law enforcement to improve equity in their county. Coast to coast, there are a number of examples of public health engaging non-traditional stakeholders. And as our work moves more upstream, so looking at causes rather than the problems, many sectors are looking toward, many sectors, including libraries, are also looking toward those root causes. So we will have a bigger impact if we work together. So I'm going to just kind of preview a few other things that are coming with this project. So we're going to have a few more webinars. We're going to have one in February talking about some of the partnerships that are happening currently in our state between libraries and public health departments. In March, we are going to be talking with people on the library side of things about how to get partnerships started with public health departments. And then in April, we're going to have a panel discussion of people from across the country who have been doing strong partnerships and strong work with one another. We do want to keep the conversation going. So webinars are great for getting information out, not so great for sharing information among participants. So we're going to have discussion sessions 2 weeks after each webinar. So in about 2 weeks, not in about 2 weeks, in 2 weeks, we're going to have a discussion session about getting started with these collaborations. So these will be very loosely facilitated. So we will have some questions, some topics up for conversation, but it will really follow the needs and wants of the group that joins. If you want more information about that, we will have information on our website very soon, hopefully by the end of today. And or else you can send me an email with any questions. We also are working with the Public Library Association, as I mentioned earlier, and we're going to be sharing some of the lessons we've learned and highlighting some of the really great success stories of these partnerships that are happening on the blog for the Public Library Association. So we're hoping to get that started in the next few weeks so we can start sharing more of this. And we will also be developing a toolkit in the next couple of months to put out. So keep an eye out on our website or connect with me by email. I'll put my email address on the screen shortly, and I'll also put it in the chat. And we hope to connect with you soon and learn more about what's going on. So Derek, I'm going to turn it back to you for a moment.
Great. Thank you so much, Lori and Hannah. That was fantastic. And the chat has just been on fire, which is fantastic. I did see a question about whether or not we can share the chat, and I believe I can download that with the recording, and I will try to do so and maybe do a little bit of editing with things and share that out with the recording as well, because I know lots of really great ideas and activities taking place and want to capture that. Hannah mentioned that there's this is kind of part of a series. There are some other upcoming free webinars from GMR's Kernel of Knowledge that are coming up, and you can see them here on this slide. If you're interested, you can register through the NNLM website. Also, with the reminder email with the video link, I will also share information about the discussion sessions that Hannah just talked about too. So everyone who registered should receive that email, and will be able to have that link provided as well. Next, you want to go to the next slide? Again, as I mentioned, we are the network of the National Library of Medicine. You have a user account because you've registered for this, but if your organization is not a member, I'd encourage you to join. There are over 9,000 organizations across the country that are now part of the network of the National Library of Medicine. And part of what we try to do is look for opportunities to engage members and foster collaborations. And so being able to identify, public health departments and public libraries within the same community that are members and facilitating a joint shared mission to health. And as I mentioned, there's more webinars and classes that you can join for free at our website. Next slide. Thank you. I mentioned you'll receive a link to the recording. I'm going to put in the chat box right now a link to our evaluation. Filling out this evaluation is how you will get access to your MLA, Medical Library Association Continuing Education Credit, or your Certified Health Education Specialization Specialist CHES or MCHES credit. So this survey, valuable for CE, also valuable for us to know what you thought of the webinar, and if we can make changes that would be valuable for the remaining 3 sessions that will come up over the next 3 months.
Derek, there were a couple questions in the Q&A, if you want to go back to that. There was one that, can you share if there were pre-existing contingencies incorporated in public library plans that may help during uncertain times such as COVID? Although many community members use libraries for many purposes, would love to learn if they are backups or alternative approaches for reaching out to frequent users, or what kind of outreach exists to help them right now. Recently, I've become struck with the elimination of contingency planning and budgets, or the lack of them in general. Do you want to, I mean, that did not come up in our work. I don't know, Derek, if you or Hannah want to comment any more on that.
Yeah, I can jump in, and Derek, maybe you'll want to add to it or correct me, but what we're seeing with libraries, and I think the same is true for public health, is that they're all very different. So what one library does, another library might not do. This is true, you know, from one community to the next, but also from state to state. So because the way that libraries are governed and operate, some may have contingency planning built into what they do, while others may not. Derek, is that your understanding as well?
Yep, I think so. And you know, I do think the examples were shared about, you know, some of the ways that public libraries have stepped up and served during disasters. And so we've seen some of that, the role that public libraries can play in that sense. But, you know, part of that question gets at, I think, where this research stems from is understanding, you know, where those gaps are and whether or not public libraries and public health departments and local health departments can foster those relationships.
Thanks, Derek. We also have a question in the chat, and I think you may have asked this earlier, so I apologize we didn't get this answered earlier, but about sharing our bibliography. We are working along with the toolkit. We're going to have a page up on our website that will be gathering a lot of this information. So I don't know that we'll put the full bibliography on there, definitely not the full 10,000 articles, but we will be sharing some resources there. And if there's anything in particular you're interested in hearing about, please feel free to get in touch with me at my email right there on the screen. Thank you all for joining us today. I'm also very eager to see this saved chat. There are so many really great examples throughout this. And the more time I get to spend on this project and thinking about libraries, the happier I am. So I'm excited to see all of the new examples that I can dig through now. So thanks for sharing.
Thank you all.
Great, thank you again. And again, I will email out the recording in about a week, and we'll include links to some of the follow-up webinars that will take place. If you did not take the evaluation, I'll put that in the chat one more time, and I'll also include that in the email out to participants. But if you have any other questions, comments, feel free to reach out to Lori, Hannah, or myself. And thank you all for your time, and we hope to see you at one of our upcoming webinars over the next couple months.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.